Hello everyone, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and in this segment I'm going to be going over World Malaria Day. This took place a couple of days ago. However, I saw um, Secretary General Tedros Ghebreyesus give a short talk on this. So I wanted to make sure that I went over this important day. Again, April 25th has been World Malaria Day. This is an important area, and one of my dissertation students are writing about this from Cameroon. There are multiple malaria endemic countries, and there's an effort to try to curb the disease and make sure to take preventative measures to try to avoid the contraction of malaria. One of the biggest treatments is actually prevention techniques is to use insecticide treated nets. Some of them are not treated and have holes. People don't know how to use them, and so that's what goes on. Let's take a look at some of the statistics. In 2022, 608,000 malaria deaths took place. 249 million new cases of malaria in 2022. So just to put into perspective, 608,000 is quite a bit of a number. COVID was actually claimed a lot more lives. However, in the long run, malaria has lasted much longer, and some would argue that many of the headway that usually is made in other diseases are not as easily made in malaria. In a moment, I'm going to be going over what the different areas are that are prevention. So 94% of all malaria cases are in World Health Organization African region. The important area is accelerating the fight against malaria for a more equitable world. So equity is at the center of all of this. People living in the most vulnerable situations, including pregnant women, infants, children under 5 years of age, refugees, migrants, and internally displaced people and indigenous peoples, continue to be disproportionately impacted. So the World Health Organization African region shoulders the heaviest burden of the disease. In fact, 94 to 95% of malaria cases and deaths took place in this region in 2022. So rural populations are living in poverty many times, and so less access to education are the most impacted, those individuals that are in view of the current trajectory, critical 2025 milestones for reductions in malaria cases and deaths will be missed. And pregnant women, young children are most vulnerable in these situations. So the idea is that accelerating the fight against malaria for a more equitable world is what's important. So there's a World Malaria Report and declarations and many things that are there. I wanted to go over this dashboard, and I'm actually built dashboards in one of the courses that I designed, and this can go into quite a few types of dashboards. Campaigns, supply chain, global fund, country support. What is interesting is malaria epidemiology, and this goes to some of the statistics that I've already gone over. However, this is a lot more in-depth. As you can see, this is very revealing, is that many of the African countries have greater than 300 per 1,000 population in 2022. So these are all the endemic countries. Democratic Republic of Congo has one of the highest rates, along with Chad, Nigeria, Burkina Faso, Mauritania, Liberia, Sierra Leone, and in a lot of these countries, I've known people that are from there. Estimated deaths, that's a lot of most of Africa. Um, what is important to notice is the rate of malaria, incidence of malaria is quite low in India. However, the deaths are still very high in India and Pakistan. So this means that there has to be more preventative measures that are taken for a lot of these countries, endemic countries. Um, Deaths increased in 7 out of 11 countries compared to 2015. Nigeria was up already and increased by 20,000. There was a slight decrease in the number of deaths from malaria, however, still quite high. And a lot of the African countries have seen increases in deaths from malaria. And this is why we need to pay much more attention to malaria. Some of the preventative measures are indoor residual spray. That's something that I believe malathion and uh, some of the other insecticides are applied. So that's indoor residual spraying. And then another technique is seasonal malaria chemoprevention campaign. And so children with malaria and other parts of Guinea has supported the National Malaria Control Program to implement the seasonal malaria chemoprevention campaign since 2017. All of these measures are being applied in order to curb and improve the situation with malaria. Now remember, again, we started off the concept of equity and something that is important to achieve before you can address malaria. A lot of the impoverished countries, people living in the rural areas are most highly affected and considered vulnerable populations. So look, we're trying to as a globally, I'm trying to combat this, and we should be able to make more progress than we have. So funding is absolutely essential to be able to do this. I hope this has made some sense. Thank you for listening.